Brenda is my director this morning. We'll ask her if we do have any feedback that's come in. Okay, so as we continue to wait for you to text in and also contribute to our ongoing discussion, by the way, if you are seeking also for solutions, let us know. We'll put you in touch with our panelists. But for now, welcome back, gentlemen and lady. Quite the debate we have here. And Dorcas, again, I'll start off with you because I remember even with the outgoing CS Mutahi Kagwe talking during World No Tobacco Day, he was talking about the issue of tightening loopholes to combat tobacco consumption. So speaking from the ministry's perspective, you know where the loopholes are. What is stopping us from getting the reduction and the dependency down? Now that you're in the ministry, tell us.
Okay, may I give you a background that the Tobacco Control Act is comprehensive.
Okay.
And you don't control tobacco consumption from one aspect only of consumption. You have to target supply of these products, that is from the manufacture, distribution, even growing. And secondly, you have to create an environment that supports people not to start smoking or using tobacco products, or those people who are using to reduce their consumption, and those who have quit not to relapse. So we have many interventions. One of them is increase of creation of awareness, first of all, on the harmfulness of these products, so that people can be convinced to stop taking or not to start. Secondly, we also provide cessation services in the health structures. We have trained over 100 facilities around the country. Recently, we went to 24 counties, and part of the conversation we were having is on cessation, integration of these services. Ministry of Health at national level makes policy guidelines. It doesn't provide services, but these services are provided in the health service system, in the facilities and in the community. We also have increased we have banned completely to promotion, advertising and sponsorship of tobacco products, and talking about it even on TV and promoting some product classified as a tobacco product like electronic cigarettes is actually illegal. And we have raised tax in Kenya to make tobacco products expensive and therefore deter people from consuming them. We have banned sale of single sticks or single units so that people can feel the pain of buying a packet. And when they buy the packet, they see the message and the health warning in the tobacco products.
Okay.
Those are the things. And tobacco consumption in Kenya is actually going down.
Okay, okay.
Yes.
And so,
the loopholes, to answer your, I'm sorry, I give you a background to create awareness. And also the loopholes, one of them is that we have new products, we call them novel and emerging products, that are trying to circumvent the legislation, including electronic cigarettes, nicotine pouches, for example. They are being introduced because the ordinary products that have been there have been controlled. But now the industry comes up with them and they say these are not products, they are not tobacco, the nicotine is synthetic, and so on and so forth, using many front groups and even professionals. But this one is one of the loopholes: industry interference and introduction of novel products. Number two is that we have illicit trade in Kenya, but we have controlled it through implementation of one of the world's best track and trace system. It is an example. We are also reducing tobacco growing, and it requires a lot of money to do all these interventions. So the country, the government has also put a levy on tobacco manufactured in Kenya or imported into the country to finance tobacco control.
And Chairman, come in here, Joseph. When you talk about how you're being categorized as alternative products within the same category as, you know, your conventional cigarettes, for example, you have an issue with that because you're falling in the same tax bracket. You're pretty much being weighed the same. But when you talk about non-tobacco products, how does that make you feel, obviously, even as an advocacy group for alternative products?
I think it's misleading for the smoker, because if what you're telling the person who's using cigarettes is that there is no difference between those products and these other products we're advocating for, which is simply not true. Scientific evidence will show you that's not true. In the US, for example, similar products such as the ones she's mentioned, the pouches, they're allowed to be labeled as safe alternatives to cigarettes. Why would the FDA do that in America if they know they're misleading the public? It's because they're not. what Kenya needs is to relook at the scientific evidence that's on the table and to let the smoker understand first that nicotine does not cause cancer. It's not carcinogenic. It is listed as an essential medicine by the WHO. So if you can use the same harm reduction science that is being used in other countries, I mean, it's a no-brainer. Yeah.
Dr. Ari, jump in because I want to sample a couple of text messages. And you know, the question here is, you're talking about harm reduction strategies. So take us again back to the facts. When you're talking about different markets, you've mentioned Sweden, you've mentioned England, and what have you. What are you actually seeing in terms of the positive outcome? How are individuals responding to these harm reduction strategies that they have, like, for example, the alternative products being introduced in the market?
Yeah, thank you very much. Just to give a brief background, the Ministry of Health uses WHO's FCTC acronym called Empower to enforce all the tobacco laws. M stands for monitor tobacco, P is to protect the people, O is to offer the services. We have enforcement and raising taxes. Of all those strategies,
yes,
O is the least implemented. In fact, studies have shown that O, offering services to the consumer,
yes,
its implementation is less than 20%. And now that is what is forming the background. If we go back to the FCTC, it defines tobacco control as a range of demand, supply, and harm reduction strategies. Our Tobacco Control Act has failed to recognize harm reduction strategies. I don't know whether it was by design or ignorance.
it's just completely ignored.
That part of harm reduction strategies does not exist in the Tobacco Control Act. Yet the Act was primarily lifted from the WHO's FCTC. Number two, WHO in 2015 came up with what we call global nicotine reduction strategies. They realized that for us to get these smokers out, we need a scientific way of reducing the nicotine content in cigarettes. And they recommended, why don't we produce or recommend cigarettes or products with less and less nicotine, what we call very low nicotine levels. That is the formation of the background of science, that for you to get this person out of nicotine, you must offer a tapered dose until they get out of. Now, science shows that tobacco has more than 7,000 carcinogenic substances. Nicotine is not carcinogenic. So what we scientists are saying, we must go back to the drawing table and ask ourselves, we have our focus is the user.
Yeah.
The user. The government can do all the other regulations. The user. How do we assist these users to quit smoking? What harm reduction strategies are there? And science has shown that when you taper down the dose of nicotine through the assistance of professionals, you will get this smoker out of smoking. Number one, you will quit their tobacco consumption habit. And
Number
we know
two,
tobacco, when you burn tobacco, the combustible cigarette, you consume a lot of cancer-causing agents, tar, carbon monoxide, formaldehyde, acetaldehyde, and so many other tobacco-toxic substances.
Okay.
The other concept is, how is this tobacco processed? Tobacco is grown, dried. There are various forms of drying tobacco. Sun, air, heat, smoke.
Yeah.
All of those drying methods will constitute addition of more cancer-causing agents into the leaf.
Okay.
Number three,
Yeah.
once it is dried, it's fermented. There is a science as to why it's fermented, to increase the nicotine level. Science has shown that the moment you ferment tobacco, you more than 10 times increase the cancer-causing agents in the leaf.
Okay. Okay.
And that is what scientists have noted. And they say, no, like Sweden, they said, we will never heat our tobacco leaf to dry.
Okay.
We will sun-dry it, and we will not ferment.
Okay. Dr. Let me stop you there because I understand we have some text messages that have come through, perhaps even questions. Brenda, please let me know. If you haven't sent in, obviously, your text message just of yet, please do, because we have about 10 minutes or so before we go live to the vetting. Someone says, good morning. I like the discussion. I stopped smoking over 10 years. I struggled with different ways to stop, so I went the cold turkey way. Never looked back, but there's no single answer to stop consuming the nicotine. Never never start is the simplest solution to avoid this plague. Okay, that's a good one from George Rukwaro. Thank you so much for that. Robert Chumba says, I don't agree. Only the safety is to stop smoking. Okay, it looks like Dorcas has someone on your team there. John Okumu says, smokers are not only addicted to the tobacco, but also the smoking act itself. I think offering alternatives like inhalers will help reduce the number of smokers, hence the effects. Chairman, getting to you very quickly. Oh, okay, wait, there's another text message here that says, it's Brian and good morning, Kenya. I don't agree with safer tobacco alternative products kwa sababu sigara ni sigara. Okay, so I know you can, or you feel that there's the misconception of
obviously
what you're talking about, and I want to give you the opportunity here to now really address what even our viewers are saying. They're saying e-cigarette, cigarette, same thing. What Dorcas is actually saying. Okay. But on top of that, are you not concerned about the criticism around your organization that seems to be promoting or encouraging young people to start smoking? You know, especially underage smoking, if I can term it as that. And what are you going to do to change the narrative and the message to be appropriate to the right target audience?
That is the farthest thing from the truth.
Yes.
We don't advocate for any child to take up any of these products or cigarettes.
Yes.
Myself, I struggled with smoking. I had been smoking for 17 years, and it was with the help of these products that I quit.
Oh.
Yeah.
Okay.
So what I want the smoker to understand is that it's the burning of the tobacco that releases chemicals into your body. Once you take out the burning, you automatically reduce the effects.
Yeah.
Or the harmful part of the cigarette. That's us advocating for products such as electronic cigarettes and nicotine gums and pouches and everything. It's because we understand that it's a struggle for somebody to quit smoking. So it's only fair to sympathize with the smoker and offer them help. In Kenya here, the cessation services she's talking about, it's just a phone call. You call to, I think, Nakada or something. It doesn't help. I've tried all those, and for someone like myself and hundreds of others outside, it's products such as this that normally help someone quit smoking.
And it's a process. It's not a one-day affair.
A process, yeah.
Okay. Getting back to you, Dorcas, very quickly, what do you think really needs to be done in the fight, okay, to reduce the dependency, the demand for it? What are the terminologies, the percentages, if you will, of the chemicals or the messaging that needs to be reconfigured to get this message home? For someone not to start or for someone to quit. So what's the game plan here?
Thank you very much, Shiko. And I really am proud of Kenyans this morning because the messages we have been saying, it shows us that really they are getting our message. And we should continue to say that to convince everyone not to start. That is really the message. And those who are consuming to quit, not to switch to other products. I would like to clarify something. The advocates of new products, novel tobacco products, including electronic cigarettes, keep saying it only has nicotine. No, it has a lot of other chemicals. And even the current studies, including the study Dr. is quoting, mentioned that we cannot assume the risk of e-liquids which are used in electronic cigarettes, and they say they have not been long enough to study the effects. That same policy study you're talking about, those are the findings. In the UK, they did studies and even found that as young as 11-year-old children are consuming these products. And even those studies, they took biomarkers or samples in the blood of the people who would consume these products. They found that one, those who are exposed, they found it existing in their bodies and it was harmful to them. They also found that there were biologic findings, changes in the body, but they did not reveal what it was. They said they needed more studies to verify. And they found that nicotine that is in these products is addictive, equally addictive. It is nicotine, and nicotine is the most addictive substance. And even a little bit of it to a new brain that has never tasted it, it triggers it to remember and reminds it to want more and more. Right. So the best thing is not even to give an alternative. There are products that are called nicotine replacement therapies, and they are in volumes. The content of nicotine in those products is so minimal that it is tapered off from a certain percentage until the person can do without nicotine addiction.
Okay.
the most effective way to consume nicotine is through the lungs. That is why tobacco industry is trying to promote electronic cigarettes, because it's inhaled, vaped, inhaled,
Right.
because it goes to the lung and it instantly goes to the brain and to the rest of the body.
Right.
They are opposed to any product that I don't hear them marketing patches, lozenges, nasal spray, etc., chewing the Nicorette or the nicotine replacement gums,
Yeah.
but they are promoting an inhaled product. This is exactly the way the industry promotes these products. Number two, there are many scientific facts that have been misrepresented this morning. Let us be factual. When we talk about what nicotine replacement therapies are, let us be sure to define them properly.
Okay.
And it doesn't include nicotine, electronic cigarettes.
Okay.
Let us also be very true that even in Sweden, whatever Sweden you're talking about, snus, which is tobacco pouches, originated in Sweden. It is a tobacco product, controlled as a tobacco
Okay.
product.
Okay.
So, lastly, you asked me what we need to do.
We are literally out of time. So
Yes, so I think we should first stop propagating
Yes.
these products because they are wrong. They are tobacco products. They cause addiction. And when you say nicotine doesn't cause cancer, electronic cigarettes have nicotine, which causes cardiovascular disease. It causes other inflammation of
nicotine
All right.
patches and
Because-
that? They also have nicotine in them.
No, but in very low levels, and through absorption through
What's
the
the
skin
level
and the
of
gum
nicotine?
is very low that
all
it
right,
doesn't cause addiction.
Dorcas, you've had your parting shot, and I think Kenyans have had you.
So my
Daktari,
parting
your-
shot, don't start. And those people who want to quit, there is services available for you, and it is not electronic cigarette. There's no safe
Okay,
alternative.
Daktari, what is your parting shot, and what would you like to tell Kenyans very quickly, your one-liner, so that we can say goodbye?
Yeah, my parting shot is that we stick to science. These alternative products have been shown to be 95% safer than combustible cigarette, and they can be used. Public Health England has actually used these products to assist their smokers. 50 to 70,000 smokers in England are quitting smoking every year. 700,000 people in France have already used these products to quit smoking. So we need to ask ourselves, we have been doing the same thing for the last 2 decades, but our smoking rates are going high.
So what
Can
next?
we get a scientific solution? Can we look at what others are doing? Can we leave it to the experts? And most importantly, if you don't use these products, please don't start.
Okay.
If you're not a smoker, remain as
But let's
such.
get
All right.
facts right.
Dorcas, we
Tobacco
have to go.
consumption is going down,
Okay,
not up.
Dorcas, we
So
have
let
to
us
end
get the
there.
facts right.
Tobacco
Daktari.
Atlas has
All
said
right,
the
okay.
In
consumption
low and
of
middle-income countries, not
Kenya
in
is
Kenya.
one. Kenya
No,
is
it's
one.
one,
Middle-income
it's one, but
country.
you have to be specific
No,
about
Kenya-
All right,
Kenya
Daktari,
It is not
Kenya
true.
is
All the
one.
things you have said
Dorcas,
this morning
thank you so much
is
for
all
your
just
time.
misleading
We're
information.
going
No,
to end
it's
it
not.
there because we have to take a live feed, okay? But we want to thank you so much for taking time to obviously explain to the viewers, and for you, dear viewer, by the way, this is a personal choice. You've had the facts on the table, whether it's, as Daktari is saying, follow the science. You can hear Dorcas talking about let's just continue with the no smoking policy and quit cold turkey. That's the only way to do it. But Joseph as well, obviously giving his point as to what has even worked for him on a personal level. And so there you have it from them. We would also want to encourage you to do your own research around this, tafadhali. But in the meantime, asante sana for the feedback that we have received so far. I know there are so many more. Pole sana will be sure, obviously, to carry forward this discussion. That being said, we are going to be going live to the vetting process that is just about to kick off in a couple of minutes, rather. It is the Cabinet Secretary nominee vetting process that will be starting as from 9 a.m. Please stick with K24 for that. Okay, have a wonderful day up ahead. Bye-bye.